Okay, you guys, why don't you guys grab chapter 22, PowerPoint. Sterile compounding this time. So specifically talking about parenteral products. So injections, IVs, those kind of things specifically here. Now we'll talk about the math part of this whenever we get to the math chapter, how we're going to reconstitute and do all that kind of stuff. But here specifically the technique. Parenteral products are injected directly into the body through skin, veins, so it has to be sterile. Sterile preparations must be kept pure and free from biological, chemical, physical contaminants, of course. Administration of an injection. So it says formulation modifications or different routes of injection can be used to slow a drug's onset. So typically, the more invasive, the faster the drug will, that's not always the case necessarily, but the faster the drug will get into the bloodstream. So, for example, IV is faster than IM. IM is faster than subcutaneous. Subcutaneous is faster than intradermally. So generally, the deeper into the tissue you go, the faster, the medicine takes, for example. Parenteral administration more readily controls the therapeutic response because since you bypass that intestinal absorption, you don't lose a bunch of the drug, then, that just gets removed or whatever. So you just need to follow your policies. Whenever you get to a new pharmacy or you're working there, this is something that you're going to be doing. Make sure you go over the policies. Make sure, you've watched people. They've taught you how to do it. Okay, aseptic technique. We know what this is. We talked about it last year in principles. Aseptic technique versus, or aseptic technique versus just like your regular medical or clean technique. Aseptic is sterile. Okay, so most effective way to eliminate transmission is through asepsis, being completely sterile, free from microorganisms. So two types, medical and surgical. Medical, of course, is just your normal clean technique. That's what you would use to prepare pills. Okay, you wash your hands, prepare their medicine. That's clean technique. Use gloves, whatever. Okay. Hand hygiene is an example of clean technique. We all know about washing our hands. Okay, hopefully everybody remembers that. How to do that: running water, friction, soap. So look, it says the first scrub in the morning should be extensive, 2 to 4 minutes. Just because you've been outside, you're going to be handling people's medications. People are already sick. You don't want them to get sicker because of something that you've done. Cleaning and sanitizing equipment and instruments need to be cleaned promptly after every use. And you don't want any kind of residue from any old medicine to get into any new medicine. Sanitization, cleansing process that decreases the microorganisms to a safe number. You just have to, that's going to be part of your job as a pharmacy tech, probably, is cleaning. And so you want to make sure it's done correctly and that you're doing a good job so that people don't get sick. Disinfection is the ability to kill microorganisms on the surface of different items. So usually use a chemical, you guys know, Lysol, whatever. I don't know what the cleaning agent will be, at the pharmacy that you work at or whatever, but disinfection, probably, like it says, commercial solutions will be used. Surgical asepsis is sterile asepsis. And this is like you destroy all microorganisms. You don't want anything of any sort, good, bad, anything, growing. So usually this is how you want any kind of parenteral medicine. Living tissue surfaces, skin cannot be sterilized, but you can use it with a sterile covering, like sterile gloves. Providing sterility. So use of surgical hand washing technique before sterile gloves are applied. So wash your hands really good, apply sterile gloves. Another example, and this is something that you guys will definitely see on your test Friday, is the use of a laminar flow hood. This provides a sterile working environment, and you're going to need to know that. A laminar flow hood provides a sterile working environment. Now, you also have to stay sterile. Okay, surgical asepsis also requires special handling procedures, sterilization of materials. So you're going to have to use sterile instruments, sterile gloves, that kind of thing. But a laminar flow hood kind of creates a sterile environment within the pharmacy to mix medications. Sterilization is the process of killing or destroying all microorganisms. So you can use an autoclave, which uses pressure. This says this kills all organisms within 20 minutes. So usually a place that's going to be doing a lot of sterile prep, that kind of thing, is going to have an autoclave. Like, it's kind of looks like a little metal microwave almost. Other methods, dry heat sterilization is another method that uses heated dry air at a temperature of 320 to 326 degrees, you know, three hours, somewhere in there. And then a gas sterilization as well. Chemical sterilization, used for instruments and chemicals, can be applied to the body for disinfection. The following equipment is used in sterile compounding. Administration sets, of course, anything that you're going to use to actually put it into laminar airflow hoods, large volume parenterals, so large volumes of medications, any kind of tubing, that's what all this, mini bags, piggybacks, like we talked about, you know, that's the extra little bag that usually contains the antibiotic or whatever, sharps containers, definitely, catheters, clamps, all the kind of stuff that goes with your IV. Filters, filter needles. Remember we talked about filter needles when we talked about ampules and the fact that they are made of glass, and so if you're using medication from an ampule, you have to use a filter needle to get rid of any glass pieces that might still be in there. So the rest of this is all just like your IV equipment. Following supplies are used in this: quarter normal saline, 5% dextrose, normal saline, half normal saline. That's what that 0.45% NaCl. NaCl is just your normal saline. We call it normal saline, okay? Normal saline is 0.9% sodium chloride. That's what we consider normal saline. That's something that you'll want to know. 0.9% normal saline, I'm sorry. So that's sodium chloride. 70% isopropyl alcohol pads, that's to clean it. And then look, D10W is 10% dextrose. Whenever you see that, those numbers in there, that usually gives you a percentage, okay? So D10 is 10%, D5 is 5%. It says a fourth normal saline, but that should be half. I don't know why it says that. Anyways, half normal saline is the 0.45%. The following supplies are used: D5 normal saline. So again, that means dextrose 5% in normal saline, which is the 0.9%, like I said. LR, lactated ringers, is another kind of a base fluid that people get. Normal saline, again, is the 0.9. And then sterile water for injection, SW. Let me tell you this right now. I read this article to my anatomy students, so you guys have already heard this, but from the rest of my students, sterile water can never be given by itself, IV, okay? It always has to have some kind of mixture in it. You never, if a doctor ever writes for that, that is something to question. You cannot give just water through an IV. You cannot do that. The reason is that what happens is your water is hypotonic to your blood cells. And so because your blood cells contain other electrolytes, sodium, potassium, all of that, then they are going to have that pull. They're going to pull water in. Osmosis is the process of that pulling of water across a membrane. And because water has so little solute in it, your cells are just going to keep pulling that water and keep pulling it and keep pulling it. When they do that, the cells are going to rupture. So you cannot give sterile water by itself through an IV. Please know that. You know, if somebody ever writes for that or you get an order for that, make sure you question it. Okay, ask them what do they really mean, and go from there. Because it's got to have some kind of mixture in it. Now, some medications can only be mixed with sterile water, and that's fine if it's a mixture. There's specific instructions, but you cannot just give somebody, an IV with sterile water. Okay, laminar flow hoods provide sterility by circulating air, filtered air in parallel flow planes. So that means it filters air, and then that's what moves air through that area instead of getting air from the outside that might contaminate whatever you're doing. There's two types, vertical and horizontal, and you do need to know the difference in the two for your test on Friday. Okay, vertical flow hoods, this type is used for chemotherapeutic agents because of the direction of the airflow and the specifics of the hood. So in both types of hoods, it says positive pressure flowing air is used, and it's passed through a HEPA filter. HEPA was on our abbreviation list maybe last week. Okay, so this filter filters out anything that might be in the air that would contaminate it. You can use this hood, it says, to mix non-chemotherapeutic agents as well. Now this gives you a picture of kind of how they work. So here's a horizontal hood, and look, you have your work surface, filters air, it goes through. And here's a shield on this one, and so here is where you would work. You put your arms kind of in here, work here, and in this one, you've got, it goes this direction, okay? Now, the reason you think about chemotherapeutic agents, this is specifically used for vertical. Now look, here's why. Here you have air that's flowing towards the worker. Here you have air that's flowing down kind of away from the worker. That's important. You don't want to be, if you're mixing the chemotherapeutic agents, you don't want to be exposed to the medicine. Okay, they have major side effects. We just learned that. So you don't want to be exposed to that. Horizontal laminar airflow. This type should be used for preparation of numerous types of parenteral medications and sterile product mixture. So you can still use this for sterile products, but you wouldn't want to use it for chemo because it's going to blow that back on you. Horizontal hoods are used in hospital pharmacies, have to be inspected. Of course, that's for anything like that. Laminar airflow hoods should be left on 24 hours a day, and they require regular maintenance. You want to leave them on all the time because you want them constantly circulating air. If you turn them off, you're going to get, pathogens back on your surface, and that's not what you want. All items under the hood should be cleaned thoroughly before you start the work. Same for their hands and their arms. It says it's important for operators to keep their hands within the cleaned area and not to touch your face, your hair, your clothes. You want to keep everything sterile as possible. Working in the airflow hood. All aseptic procedures should be performed at least 6 inches inside the edge of the hood in a clear path of the airflow between the filter and how you're working. So that is, I've seen that question before too on the test, so make sure you look that up. Nothing should touch the filter, and the work area should be cleaned after each use with alcohol. So here is an example of the airflow hood. So you can see they've got their IV bag here, they've got on their mask and everything, sterile gloves so they can keep everything sterile. They've got their syringe so they can put their medication into the bag where they need to. And look, there's even a sharps container inside here. Okay, technique. It says aseptic technique must be strictly applied to when preparing parenteral products. Again, this is going directly into their body, and you don't want to inject pathogens directly into their body. Parenteral products can be contaminated air by the personnel, all kinds of stuff. So these are some things when you're compounding a parenteral product. These are some things you want to take into effect. The route of administration. Do they need it? Is it IM? Is it IV? Is it sub-Q? Because that affects how much you can dilute it in as well. Pharmacokinetics. How does it work in the body? Solubility. Will it, is this powder soluble in this solution? Do those work? Is it stable? How long is it stable? Is it stable for 12 hours? Can you mix it ahead of time? Can they reuse the vial? Is it compatible with the other medications that they're taking? Packaging. Okay, TPN, this is what I was talking about earlier. Total parenteral nutrition. Provides lipids, proteins, electrolytes, sugars, salts, vitamins, anything that they need for nutrition. So people who cannot, like if maybe they have undergone some kind of abdominal surgery and they can't have anything going through their digestive system, they would be placed on TPN for a period of time, at least if, depending on how long they're going to go without it. This is very, very, very tedious mixtures, okay, because there's so many ingredients that go into TPN. They're compounded in a laminar airflow hood or in a biological safety cabinet. So again, with the sterility, it's really important. It says they have to be compounded by either hand or automated mixing devices. So the base components have to be mixed like this: dextrose, sugars, amino acids, lipids, and then sterile water for injection. A standard total parenteral solution contains 42.5 grams of amino acid and 250 grams of dextrose per liter, and they'll get it in big bags. But everybody's is going to change depending on their diet, depending on what issues they have. What they put into a TPN solution may change. There are automated filling devices that may be used to compound TPN solutions. These are linked to computers to help control accuracy, and then each ingredient is pumped into there in a specific sequence in order for it to stay stable. And then they can detect if the specific gravity is incorrect for any of the ingredients. It's a very, like I said, very tedious process. Okay, an IV piggyback says may be prepared in several ways depending on what you're doing. Traditional method, a vial of medication is added to an IV med by removing the contents of the vial and then injecting it directly into the bag. So you can just inject a medicine into an IV bag, mix it, and they can get it that way. It says today vials of antibiotics can be attached to IV bags without actually mixing it before they use them. They're mixed at the time of administration. So sometimes you just mix them right then and there. Large volume parenterals are able to deliver large quantities of electrolytes, TPN, chemo, or other fluids. So these are like your IV, like you get a whole liter of fluid. It's important to check dates, stability. Does it mix with the other medications that they need? What else, is going on? IV admixtures can be sterile products added into an IV fluid. So sometimes you might see potassium might be something that needed to be added in because they were low on potassium or something along those lines. Have to be mixed with aseptic technique again, and then you have to use a new syringe every time it's clean. The USP, it says, is set the standards for compounding, preparing, labeling drugs, and then there's specific things that are required, how things are labeled, and so forth. Look, a beyond use date is calculated from the time that it's compounded until it's administered. So they need a date. You have to use this by, X day and time. Non-injectable products that have to be sterile. So a few more things. Ophthalmics, so this is eye solutions, goes into the conjunctiva, so they need to pull down their bottom eyelid, and you actually put eye drops into the bottom eyelid, like when you pull it down. It doesn't necessarily go directly on the eyeball. Process for compounding these properly takes 1 to 2 weeks. Sometimes you use irrigations if they had surgery, or if they had something put into their eye, might need to irrigate it. Compounding records are mixing reports, and they might be computerized, probably are this day and age anyways. They would be used to document what goes on in compounding. So specifically hospital pharmacies, that stuff is going to be used, and retail pharmacies too. I mean, you're going to be compounding some. Expiration dates, lot numbers. All medications come with a lot number, and that just tells when they were actually made, and that becomes really important when you start seeing adverse effects or side effects or infections. That way they can trace it and figure out what was going on. Following topics should be covered by the policies manual, so some things to look at in your own job. Obviously, these are things we've talked about. Same with storage handling. Each pharmacy is going to handle things a little bit differently, and that's kind of up to each pharmacy. And that is it, you guys. So make sure you get all of your work done online. Make sure you are studying. Make sure you're getting it all done this week. I know it's going to be a quick week. Get it all done within 1 week, but I know you guys can do it.